This is an LA Times Studios podcast.
Welcome to Live and Well, the podcast where we break down health and wellness topics with the experts who live and breathe them. Today, we are talking about a topic that most of us deal with. Maybe you're dealing with it right now as we speak. It's those dark spots on your face, not freckles, but age spots, sunspots. And we're going to talk about the difference, because there is a pretty big difference, not just in what they are physically, but how to treat them and make sure you are well informed to be able to identify what is an age spot versus a sunspot and seek out the treatment that's best for you. And joining us today is an expert, a friend, a dermatologist to the stars and everyone who wants to have great skin, Dr. Nancy Samolitis, or Dr. Sam, as her patients affectionately call her. Tell us a little bit about yourself.
Thank you so much for having me. As you mentioned, I'm a board-certified dermatologist. I've been practicing for 20 years. I moved to California in 2008 and have worked in a bunch of different practices before opening Facile in 2016. And as of a few years ago, we launched our skincare line.
It's a great skincare line, and we're going to be getting into some of those products in a bit. But for what we're here to talk about today, I want to just give a little personal anecdote, because I did come to you and I said, I have this spot on my cheek, and no matter what amount of vitamin C tinctures and serums out there on the market, spot treatments, nothing will get rid of it. And tell me what you said to me that day when I came to you with my pesky spot that I thought I was the only person in the world who was plagued with this and couldn't get rid of it.
You and every patient that I see almost every day.
Yeah.
So I said to you, this is different than a sunspot. I don't like the term age spot, really. I think that's just not, I like to call them wisdom spots. So
I'm here for that. That's fine.
This type of growth medically is known as a seborrheic keratosis, or we call them SKs for short. And they are genetic. They come up as we age. I think the youngest, I usually see them show up in even sometimes in the 20s. But I would say most people who are in their late 30s, early 40s will start getting them. And then most people in their 60s and 70s surely will have some of these. Definitely some people genetically are more prone to them than others. Some people literally have hundreds. I'm talking about not just on the face, but on the whole body, on the scalp. They can really be everywhere and anywhere. So they are in a lot of non-sun exposed areas typically. So we know that they're not necessarily from the sun.
Got it. And is there a certain ethnicity that is more prone to getting these SK or wisdom spots? Because as a Filipino woman, I do notice a lot of the women in my family, while we don't really have a lot of fine lines and we may not show aging in that way, we do have a lot of SK age spots. So I don't know if that's specific, or is there one demographic that tends to get them more than others?
Yeah, although seborrheic keratoses themselves do not discriminate, there is a type of seborrheic keratosis that we refer to as dermatosis papulosa nigra. So that means basically little dark dots, or we call them DPNs for short. So we like to shorten everything from like my last name to diagnoses.
Strictly acronyms.
So DPNs are those little, sometimes they're even like 1 or 2 millimeters, but then they can be larger. Under the microscope, they are exactly the same as seborrheic keratoses. They can either be flat or they can be sort of raised. They usually have kind of a flat top instead of like a rounded top, like a mole you would typically think of. And they tend to be kind of sprinkled over the cheeks and kind of around the temples, and very common in Asian and African American skin types.
Got it. So to the naked eye, because you said under a microscope, it would look raised, almost like a mole. But to the naked eye, for somebody who's got these pesky spots and they really want to address them, you'd say that if they are being stubborn and they're not sort of going away, the best thing is to go visit a dermatologist like yourself or, a skincare specialist who would be able to identify the difference.
Yeah, absolutely. Because these are actually growths, they're not just pigment. So when you're talking about something that's just pigment, melasma, hyperpigmentation, there's not really a way you can treat them at home. So yes, I recommend seeing a dermatologist in order to have them removed or talk about having them removed. But they also don't need to be removed because they are benign. So it's strictly a cosmetic thing.
Okay, so that's a good point. So they are always benign. They're not like a mole you would get checked.
Correct.
So it's pretty much just cosmetic.
Exactly.
Well, and that's okay.
I think sometimes they're kind of cute. I mean, the little ones are cute.
Sure. Mine was a bit, I guess I'd call it splotchy.
Mm-hmm.
So
well, yours was unique because it was flat. Sometimes you can actually see the texture on the surface of them, and that's one of the diagnostic criteria, how we can identify that it's one of those.
Okay.
A lot of people notice that when they put self-tanner on, that the self-tanner kind of sticks to the texture. And we see that a lot on the body because sometimes on the body in people with fair skin, the spots will be really, really light. And then when they put self-tanner on, they sort of light up. And I've actually had people come in and they put the self-tanner on before. They want me to remove the spots, but they want me to be able to find them all. So they make them darker.
Oh, that's helpful for you.
The other thing kind of similar that we see is that some people have them in their hairline.
Oh, interesting.
In the scalp in general, but they do seem to have a predilection for the hairline. And when people dye their hair, the keratoses will absorb the hair dye and they'll look really, really dark or black. And so then the patient will come rushing in with this sort of emergency appointment because they think they have this new like black spot that they've never seen before.
Oh,
and it was
just
there.
Kind of
they just dyed
the
it.
color.
Yeah.
Oh, that's one way to find them.
Yeah.
If you have gone to your specialist, your dermatologist, and they identify this as SK or an age spot or a wisdom spot, and so you're on the right track to treating it correctly, what are the different ways someone can go about, and their different options to start to, I guess in this case you'd call it remove it because it's not so much fading it, you have to remove the spot.
Yeah.
So where do you start there?
So there are a few different ways of doing it. A lot of the lasers that we use for skin rejuvenation, like the Fraxel or a similar laser that's gentler, like the one that you've had before, those lasers are fractionated. So they're basically removing, you know how your skin feels kind of rough after you do them, but it doesn't peel in big sheets of skin?
Sure.
So we're only peeling off these like little sections or dots, or we call them thermal zones of skin. So when you go over a seborrheic keratosis with a fractional laser, you're only removing part of it. So usually it will look like it's gone or almost gone, but then it will come right back. Because it's there and it's a growth that's living on your skin. So it will just kind of grow back to how it was before. So you really have to remove the lesion in its entirety. The tricky part about doing that is we don't want to leave a scar or a hypopigmentation, which is where the spot was, is now like a white spot.
Lighter.
So you can do it with liquid nitrogen. You can do it with electrocautery, where you take your little electric needle. I usually do that for the smaller ones where we kind of burn them off like buzz, buzz, buzz. With the liquid nitrogen, when you freeze something, it spreads out more, so it makes sense for a larger spot. But I always tell everybody we need to do this maybe in a series of treatments, because if I try to be aggressive, you'll probably have a white spot or a scar. But I'd rather like chip away at it, where we're sort of like peel off the top and then peel off a little more and then peel off a little more. And like yours, it's now undetectable.
Okay, so going gradual, because if you try and sort of attack it and do it in one fell swoop, you could exacerbate the pigmentation issue.
Right.
And hypopigment instead of the hyperpigmentation you're trying to deal with.
Exactly. And these are superficial, though. So moles can be really deep. They can go all the way down to the fat.
Okay.
And so with a mole, now some people wonder, why can't I just take the brown pigment out of the mole and with a laser or freezing or whatever? Unfortunately, the mole has melanocytes that are deep down into the skin because it's a growth of melanocytes. And those start at the base layer of the epidermis. And so when you remove a mole just on the surface, it usually will grow back. But these seborrheic keratoses are purely epidermal, so you really just need to remove the surface. Some of them are just thicker than others, so they can be a little bit more stubborn.
None of the treatments you'd have to get rid of the wisdom spot are invasive by any means. They're
Correct.
all topical.
Yeah.
And what would you say, like, not price range? I know it depends on who you go to, but it tends to be like a laser, which can start around like a few $100s and go to like the thousands. But there's really no topical solution to deal with it, right?
There's not. I suppose, I don't want to recommend something that I don't think is a good idea, but
Okay.
you know how over-the-counter you can buy the wart removal solutions? They're kind of like a potent salicylic acid. You can't really hurt yourself with that, but kind of similar to a wart. Those are purely epidermal. They're benign, and you can sort of peel, and get them off.
Interesting.
I think if you tried to do that with seborrheic keratoses, you would be unsuccessful, and we would find it a little disappointing.
Right.
It would take a long time, and so I
go see your
usually don't recommend
your
it,
local derm.
But unfortunately, there's not really. Sometimes when these growths can be thicker, sometimes they'll come up like under the bra line or under the waistline, and the friction from clothing will cause them to actually like thicken up. And sometimes patients will say they scrub them off, and then, of course, they come back because they didn't remove it entirely.
Oh. I always knew there was a difference between an age spot and a sunspot, but now it's like you're saying that an age spot is almost more akin to a wart. You're not saying it's a wart.
Well, they can be wart-like. We sort of describe them as wart-like sometimes.
Got it.
The one that you had on your skin because it was flat, those can look almost undifferentiable from like a freckle. So because some freckles are, they're well circumscribed and they're brown and they're flat. But those can usually be removed easily with a laser or brightening creams or treatments for like sun damage.
Got it. Well, speaking of sun damage,
Yeah.
so I think more people deal with sun damage and melasma maybe than SKs. It's more, maybe it's about the same. But you do hear a lot, especially as we are living in a sunny climate. People talk a lot about melasma and hyperpigmentation. So tell me about how often do you see that in your practice, and what sort of the range people can have of melasma and hyperpigmentation?
So melasma is a skin condition that's more common in women. It seems to be triggered by estrogen. It may also be triggered in a way by thyroid hormone changes. So there's a hormonal component, there's a sun damage component, and there's also an inflammatory component and a heat-related component. So melasma is sort of a more complicated skin condition, I guess, than just sun damage. Because sun damage are just changes that our cells undergo from chronic UV exposure that leads to all the things we associate with aging, like wrinkling and dullness and texture change and brown spots. So melasma is a little bit of a different beast. I consider it more of a chronic condition, and it usually requires maintenance. So similar to something like acne or rosacea or eczema, it can come and go. It flares up in the sun. It flares up in the heat. And some people are just predisposed to it. So I really like to categorize melasma as like its own thing.
Sure.
Hyperpigmentation is something that usually happens as a result of some sort of inflammation. So classic example is I have a pimple, I picked at it, maybe I was outside and it got some sun exposure, it left a dark spot behind.
Okay.
And it can happen to any skin tone, but people with more melanin in their skin are more likely to hyperpigment, even if there's less inflammation to start with. So you could get some eczema and it could leave dark patches, or you could have a scratch or a burn or something
Acne scars.
really mild,
Yeah.
and it's hyperpigmented. Hyperpigmentation is where the pigment is in the deeper part of the skin, in the dermis. So it usually fades away with time as the skin naturally turns over, but it can take a lot longer, and it can be challenging to treat because some of the treatments that we do in the office can also cause inflammation. So say we do a laser or microneedle, we're causing wounding on the skin. So there's a risk that we can actually cause hyperpigmentation. So in somebody who already has hyperpigmentation or is prone to it, before we do any procedure in the office, we usually like to prep their skin with some kind of brightening cream product that they're using at home so that all of your pigment producing ability is turned off as much as we can. So that way we're reducing our risk of hyperpigmentation from our procedure, and then we're going to get a better result with less risk.
So interesting. Okay. So when it comes to treating them, let's start with sort of like out of the office, like over the counter, all the different serums and creams and whatever, sprays, toners.
There's so many.
There's so many exfoliators, that you can get at a CVS or Sephora or whatever. Is it the same ingredients you're looking at or to treat hyperpigmentation and melasma, or are they two separate sort of treatment tracks?
No, we use the same ingredients to treat both of them.
Okay.
There's, I think, a pretty short list of ingredients that are actually effective.
Okay, what are those?
Although there are a lot of things out there that claim to treat hyperpigmentation.
Okay.
And, a lot of hyperpigmentation gets better on its own. So with sun protection, time, and then maybe if the offending agent goes away. So say somebody's pregnant, they get melasma, and then they're not pregnant anymore. Even if they don't treat it with something, over time, it may get better.
Okay, so for people who it's not a circumstantial situation and they're going through hyperpigmentation or melasma that they're trying to combat, what are the actually effective ingredients that you want to seek out, actually spend your time and money on?
Yeah, so my favorite ingredient for hyperpigmentation and melasma is something called tranexamic acid. We first discovered this actually as a prescription drug. So it's an oral medication. It's used for something totally different normally. It's used to reduce heavy bleeding. So it's used in surgical instances where somebody has a bleeding disorder and they may bleed more during surgery, or women who have heavy periods are given this medication to take during their period to reduce the bleeding.
Wow.
Women who are using it for heavy periods were noticing that their melasma was getting better. And then we started using it. I started using it around 2019 orally. And right around that time, it was also becoming available as like an over-the-counter skincare product.
Okay,
so
like a topical.
Exactly.
Okay.
You can now buy tranexamic acid. Usually the percentage is around 5% in a topical.
Okay.
Before we formulated our serum for brightening, I actually had a compounding pharmacy making a combination of different topicals that are effective, and it took a while to kind of find that right combination. So tranexamic acid and azelaic acid is another one. So azelaic acid has also been around a long time as a prescription, traditionally used for acne and rosacea. But it was also kind of noticed as a side effect that when people use it for their acne, the discoloration from the acne went away better from the azelaic acid. So it does have some brightening abilities. By itself, it's not super potent, but in combination with other brightening ingredients, it is.
But it sounds like something that could be good for sensitive skin, too, if it was originally for acne and rosacea. So that's a good one.
It's very well tolerated.
Okay.
Even at the prescription doses, we don't have people complain of irritation or dryness or peeling. It's also pregnancy safe.
Oh, good.
Which is awesome.
Yeah.
Antioxidants, I'm going to just put those all in one category because a lot of products will have combinations of antioxidants, but the classic one that everybody loves is vitamin C.
Sure.
And the way antioxidants work, they don't specifically work on pigment, but they work on the sun damage. So they are functioning to repair the oxidative stress that causes the sun damage that causes the pigmentation.
Got it.
So it's a little bit more of an indirect path. But definitely we know from a million studies that pigmentation gets better with use of topical antioxidants.
And with something like vitamin C, I see different products with different percentages.
Yeah.
So what is like an effective percentage, but not something that's too much? Because I know like when it gets into the 20% and things like that, even though that might sound appealing to someone who just really wants to aggressively go after their sunspots or have a brightening effect of vitamin C, I think it could not mix well if you have reactive skin, right? To get a higher percentage.
More is not always better, for sure, in
Okay.
skincare.
Okay.
So usually at least 10% is a good concentration for vitamin C, especially when it's in a product by itself. Usually if it's combined with other ingredients, it's going to be a lower potency because vitamin C is very unstable by nature. So unfortunately, one of the problems with vitamin C products is that they can break down easily. So your vitamin C may not be as potent as the bottle says after you've opened it and exposed it to air a bunch of times.
Got it.
But vitamin C overall, and all antioxidants have that instability. But it's often combined with other antioxidants. Vitamin E is one, ferulic acid. These are like commonly used antioxidants.
And those used with C, do those help the C become more potent, or they're just a nice cocktail of antioxidants?
Usually they just work better in harmony. And in general, I like combination approaches because you're sort of targeting one problem by with different methods. And most of our skin problems are multifactorial. So it's not like, oh, it's just one problem and one drug fixes all of it. So,
right.
And that's why part of how we treat melasma and hyperpigmentation is also targeting the sun damage itself. So ingredients like niacinamide, which again, not directly related necessarily to pigment production, but it helps to repair the UV damage. Other things like exfoliants and retinoids help to increase the speed of the skin cell turnover. So you're removing more of the old pigmented skin. So then when the new skin comes in, it's less pigmented. There are some other kind of, actually I saw a patient yesterday with melasma and she tuned me into some brightening ingredient that is available in Europe and not here. I forgot the name off the top of my head.
I immediately want it.
There are a few skincare companies that have patented tyrosinase inhibitors. So tyrosinase is an enzyme that is mandatory for the production of melanin.
Okay.
And so what I tell everybody is your normal skin tone, which is like the never sun-exposed part of your
Inside
skin.
of your arm, like forearm.
Exactly. So that's your base skin tone, and that's determined by how many melanin-producing cells you have. And then the sun, of course, will increase the melanin production. So a lot of people have something called actinic bronzing, or you can call it a permatan, where like their sun-exposed skin on, say, their arms, their chest, their face, their hands is darker than this skin. But if we prevent melanocytes from producing pigment, we can lighten the skin to the base of your like non-sun exposed skin, like max.
Okay.
So tyrosinase inhibitors, the most commonly used one is hydroquinone. So that one now is only by prescription. But there are a lot of these non-hydroquinone tyrosinase inhibitors that different companies where everybody's looking for one. Like, we got to find another one that is safe and you can use it long term. It doesn't have any side effects. So I know that La Roche-Posay has one and Eucerin has one. I just don't know the names of their proprietary ingredients off the top of my head.
But they essentially work as a melanin inhibitor.
Exactly, yeah.
Interesting, because I know hydroquinone has kind of had a little bit of a stigma because it's not, like, I think you can't use it if you're pregnant, or it hasn't been cleared in a way that is clean necessarily.
Yeah, there are a few sort of unsavory things about hydroquinone.
Okay.
It works great.
It does work.
So
I'll say that.
Usually when I see somebody with hyperpigmentation and or melasma, I'm like, let's start with this. It's temporary. it gives us a good start where you're going to be excited about the results you're seeing.
Sure.
And it's a little easier to maintain than it is to like initially get the pigment cleared up.
It's like a good kickstart.
Exactly.
It kickstarts the skin because you should only use hydroquinone for a limited window of time, right?
We usually recommend like 3 to 4 months, and then we try to take a break from it. Usually if you're taking breaks and then using it for a short period of time and then a break and then you can use it again, I haven't ever seen any complications from hydroquinone ever. There is a condition called ochronosis, which is pretty rare. It is more common in places where you can buy high-potency hydroquinone over the counter. So people, when you can just buy it over the counter and it's not really regulated, then people use it, and they use it for years and years.
Oh.
So this type of pigmentation is actually, it's like a paradoxical hyperpigmentation that looks a little different than typical hyperpigmentation. It almost has a bluish gray tone and very, very difficult to treat.
Oh.
But that is a known complication of long-term hydroquinone use. And we're all scared of it.
Don't do it.
So when we prescribe it, I have to cut people off sometimes because they love it.
Yeah.
But I'm like, no, you got to take that break and then use your non-hydroquinone alternatives and over-the-counter non-prescription brighteners as your bridge therapy. And I try to have people do that in the winter when they're lower risk for the pigment coming back.
Right. It is a good time to. So during the summer months, is that not a great time to be doing these hyperpigmentation, melasma treatments?
I actually think it's the best time.
Oh, it is? Oh, okay.
Because it's going to prevent your melasma from flaring up because of the sun and the heat.
Oh.
So that's the best time to, because it's blocking the pigment production, it's better to use it when you might produce more pigment and then take a break from it in the times where it's lower risk to produce too much pigment, like in the winter.
Well, we were speaking about over-the-counter ingredients, and I happen to have from the dermatology boutique that Dr. Sam is a co-founder and co-owner of, called Facile. This, though, I wanted to highlight because it's called the Brighten Targeted Pigment Serum. So it has pretty much all of the ingredients on your hit list as far as brightening and combating hyperpigmentation and melasma. So tell us about everything about this. I've used it. It's amazing. It really is brightening. It's such a good and easy one to include in your daily regimen. It plays well with other things. It's great under makeup. But tell us a little bit about the Brighten Serum from Facile.
Yeah, so this is the one that I mentioned. I had a compounding pharmacy mix these ingredients for me beforehand so I could test it out on patients before we even developed the line, years before. So the tranexamic acid, my new favorite ingredient for melasma, azelaic acid, and niacinamide. So niacinamide's a B vitamin. Also, all of those ingredients are pregnancy safe. So it's great that women can use this product during pregnancy and while they're nursing as well. Because this one is over-the-counter strength ingredients, sometimes I recommend using it morning and night to get maximal efficacy, or we could incorporate it with some of the other ingredients in the skincare line, like the retinol in the reverse serum and the Buzz exfoliating mask. So that way you're also targeting that sun damage component, and then this is targeting the pigment component. But this has been very well tolerated from my patients' reports and from the reviews we've gotten online. It's a really lightweight serum, so it does play well with other ingredients. It has a little tiny bit of luminosity to it.
Oh, it does.
So it kind of gives you a little instant gratification, which is nice. It's not like a shimmer or glitter or anything, but just like a nice luminosity. So I like to use it in the morning before my sunscreen.
Nice. And so, this is something people can use every day. It's not like a hydroquinone where you have to use it within a certain window. Right. You can just kind of use it year round.
Yep.
And it's okay to go in the sun. And I have heard that vitamin C makes your sunscreen work better. This is what someone told me. I don't know what that means. But, especially in warmer months when we're looking for antioxidants, whether we're traveling or, just trying to de-stress the skin. Is that a true or false statement that it does somehow like kick up your sunscreen or,
A little bit.
efficacy a little?
So this is why I usually recommend antioxidants in the morning because they have more of a protective effect.
Okay.
And then I usually recommend repair, products to use at night because they're more restorative. Antioxidants are, they prevent oxidative stress. So oxidative stress is something that happens when cells are exposed to something that is a stressor in the environment, UV light being the one we're talking about, but also there's a lot of different pollutants and things that cause oxidative stress, smoking, for example. And so those serve to prevent the damage, and actually niacinamide does the same thing. And I don't believe there's a study on oral systemic vitamin C on this as there is with niacinamide, but 500 milligrams of niacinamide taken orally. They did this study in Australia where there's a lot of skin cancer and precancers. So they looked at people with existing skin cancers and precancers and treated them with oral niacinamide daily. And it reduced their incidence significantly.
Oh, wow.
It didn't make the skin cancers disappear, I'm
Sure.
not saying, but it reduced the new skin cancers and precancers that were occurring on people who were already known to be high risk.
Oh, wow.
And this was reversible. So when they went off of it, their risk went back to normal. So what the niacinamide's doing, it's mitigating the damage that's happening. So that the SPF, sunscreen, prevents the UV from supposedly like getting on your skin, but then all these other ingredients are mitigating the damage effect that the UV is having.
Wow.
And there is an oral antioxidant called polypodium. The first brand that came out you might have heard of is called HelioCare. So this is a supplement that gives your whole skin systemically a little bit of that sun protection. It's not equivalent to a sunscreen.
Oh, wow.
So when you take this, the HelioCare, now they have niacinamide, polypodium, and some of them have vitamin D in them as well.
Oh, so they're
because
like a
vitamin D
capsule.
Exactly.
Oh, so using that, if you have sun sensitivity or melasma or, reactive skin that reacts to sun, taking something like HelioCare, like an oral capsule, then plus would you recommend to do it with like all the ingredients we already talked about?
Exactly.
Like sort of targeting from the inside and outside?
Exactly, yeah.
That's a great idea.
Yeah.
Okay. Well, we talked about, as far as really attacking a dark spot, hyperpigmentation or melasma, we mentioned lasers. And lasers are pretty common now. People hear about them a lot. They hear about Fraxel. They hear about Claire and Brilliant or brightening laser. But I also am like a little fearful of lasers because they're not nothing. I mean, they're not cutting your face open, but they can still cause some damage if you're not going to the right place or, the practitioner isn't totally skilled in it. So when you're approaching a dermatologist or an esthetician about a laser and hyperpigmentation or melasma, like what are key things to know?
Lasers, when you mentioned lasers damaging the skin, I mean, we are creating some sort of a controlled burn. We're taking energy from light, which is what the laser is. It's a beam of light. And we are creating a targeted heat-based effect on the skin to have whatever kind of outcome we're looking for, whether it's just like skin rejuvenation, which we call resurfacing, or specifically targeting pigment, or targeting like tattoo pigment, or targeting blood vessels. So there are different lasers that have different targets in the skin. So you want to look at like what kind of laser is this and what am I targeting? And then there are devices called IPL or BBL, and those are intense pulse light, broadband light. And those have a broad wavelength, so they target lots of different things. And you have to, when you're looking at the patient, you have to narrow down what kind of light energy range that you want to use based on what you're targeting, if it's hair removal or redness or brown. So I don't have any of those devices. I think they're very popular in a lot of med spas because they're sort of like, oh, it's this one device and it can do all these things. But I think that more specific lasers do all of their own specific things a little bit better.
So you want something more targeted.
Exactly.
So what are your favorite lasers for targeting hyperpigmentation or melasma?
Yeah. So the thing to watch out for with lasers is that if you are using a pigment-specific laser or an IPL, the thing is that the heat is going to be attracted to your melasma pigment, and maybe the surface part of the melasma pigment will come off, but the deeper pigment can get worse, and you can create more pigment because you put all your heat right into the melasma. So that's why I don't love those kind of lasers for treating pigment. It sounds weird. I'm like, I don't like the pigment-specific lasers for pigment. Usually when we do use lasers to address hyperpigmentation and melasma, we're really treating the sun damage component. So we're doing resurfacing. And if you do it gently enough, you're less likely to exacerbate the pigment because you're using less heat. You're using specific types of wavelengths that are more superficial. Or my favorite thing to start with, especially if somebody has a higher risk or more severe pigment, is something like microneedling where there's no heat at all. But then we're just forcing the skin to repair itself. And so you're getting the sun damage repair without the heat and the extra risk.
Okay, Dr. Sam, it's time for some rapid fire questions. Hopefully you can give us a sense of how you live well. All right, so just give me quick answers that come to mind. Candles or incense?
Candles.
Botox or bangs?
Oh, Botox. I wish I could have bangs, though.
Fake bangs. We can get some clip-ins for you. Cardio or weights?
Weights.
Scent. Musky or woody, or bright or floral? Like musky/woody or bright/floral?
I'm going to go musky woody.
I'm with you. Coffee or matcha?
Coffee.
Coffee or Diet Coke?
Coffee.
Early bird or night owl?
Early bird.
And what is a familiar scent in your beauty world that instantly calms or comforts you?
Biafine.
Okay, I know what biafine is, but explain to our listeners what biafine is. And okay, I could see that it's comforting, but what is biafine?
I wasn't prepared for that question, so
I think biafine's comforting.
That's what came to mind.
Yeah.
So biafine is, in the U.S., it's by prescription. You can buy it over the counter in other countries. Is a healing emollient cream. We use it for post-procedure. So I apply it on every patient immediately after laser or microneedling because it's a wound healing agent. It's not just a barrier cream or a moisturizer. And it just has a characteristic smell, and it has a cult following. And a lot of my patients, when I apply it, they go, oh, is that biafine? So
I think
I
a
love
lot of us like it because I think it's been, did you tell me it was a French burn cream?
Yeah.
Okay, so
very popular in France.
It's very popular in France. And it does kind of have a lotiony smell, but it's like a thick cream. And it is just, it's not scented, but it is a very comforting scent. And it's literally comforting to your skin because I've had microneedling or lasers done with you, and it burns, it hurts, the procedure, and then immediately the biafine calms it down. So it is very calming. I love that. What are you doing, taking, or practicing right now that gets your endorphins going immediately?
Exercise.
What are your 3 tips for living well?
Eating healthy food, meaning whole food without preservatives. Exercising at least 15 minutes a day, and sun protection.
Very wise tips. Thank you so much. And thank you so much for being here today.
Thank you for having me.
Thank you for tuning in to Live and Well. We'll see you next time. Livin' Well is hosted by me, Melissa Magsaysay. Our producers are Jordan Patterson and Hannah Matner. Our video director is Julia McCabe. Our director of post-production is Patrick Stewart. Our video editor is Hannah Matner. Our senior sound recording engineer is Nick Norton, with additional audio engineering from JTB Studios. And motion graphics is by Dougal Hinkin. Ben Church is our senior coordinating producer, and Anne-Marie Hauser is our production manager. Our podcast marketing manager is Bryn Jura, and our product marketing director is Becca Dorman. Our general counsel at LA Times is Jeff Glasser. Special thanks to President and Chief Operating Officer of the Los Angeles Times, Chris Argenteri, and Executive Editor of the Los Angeles Times, Terry Tang. Livin' Well is created by LA Times Studios President Anna Magsaysay and executive produced by Darius Derrickson.